Jeanne Lankin, and I'm a licensed clinical social worker with an expertise in working with people who've experienced and continue to suffer from traumas from their past. I'm an internationally certified EMDR and EFT advanced practitioner. Additionally, I utilize CBT with people who suffer from anxiety, depression, and life transitions. I have 30 plus years of experience as a psychotherapist in a variety of mental health settings. Some examples are working inpatient and outpatient in a psychiatric hospital. I also worked in a very, very established United States hospital, working with people who were newly diagnosed with serious cancer diagnoses and treatment. I've worked for many years in a phobia clinic doing behavioral desensitization and in vivo excursions for my clients who were confronting things that were difficult for them. I've worked in social service agencies for many years, serving as a supervisor for both staff and students, and doing a lot of community outreach, and for many years in private practice. I'm a pretty passionate person, but I work hard and I play hard. I love to travel. But every time I get on an airplane, and when they announce in the event of a change in cabin pressure, and if you're traveling with someone who's dependent upon you, when the air mask goes down, put the air mask over yourself first and then help them. So my takeaway from that is to bring a message home to my clients is that we all need to prioritize self-care. Because when we take care of ourselves, we will be able to cope with life stressors more easily. With me, therapy is a team effort. I actively listen to what my clients are bringing to the session. There's no template for every client. I do a thorough life history. And then the client and I determine therapy goals for treatment. However, as someone who specializes in trauma, I do see a lot of things through a trauma-informed lens. If it's appropriate, I help my clients acknowledge that sometimes their traumatic backgrounds are preventing them from moving forward in their lives. As you all know, our world has drastically changed with the pandemic. Just as my 1-year-old granddaughter can know if someone is smiling through a mask, we as a society have adjusted to this new normal, and we've been able to take advantage of what technology has to offer us. Teletherapy has made it possible for everyone to access the most appropriate therapeutic modality from the comfort of their own home or office. And as a clinician, seeing someone in their own environment gives me greater insight and understanding into how they lead their lives.